Hello everyone, welcome back to the show. I'm your host, Aaron Herman. We're here at the J-Post conference in New York City. Let's take a closer look. Rehabilitation is critical when you're in pain, you're going through surgery or a trauma that you experience. And Israel has had its difficulties in this space for a number of years. And your hospital is doing something very interesting when it comes to rehabilitation and also mental health. That's another important thing that Israel needs help, especially now. So tell us a little bit about what's happening in your hospital and how you're helping people.
So I'm Dr. Dinah Kogan, and I represent the Tzafon Medical Center. I work for the Friends of Tzafon Medical Center. Tzafon Medical Center, or previously we were known as Poriya. We were a hospital situated in the northern part of Israel, just above the Kinneret. Quite a few years ago, we recognized and realized that the rehabilitation services provided and offered to the residents of the north were lacking. And this was something that we wanted to address, and with a governmental decision that was taken in 2017 already, we began establishing or building a rehabilitation center, basically a new hospital, the first and only rehabilitation center in northern Israel that provides holistic rehabilitation services, both geriatric but also pediatric, that were lacking before, neurological, orthopedical rehabilitation services to the residents of the north to enable them to receive rehabilitation close to their homes, close to their families, so that they won't have to travel all the way to the center of Israel to receive those services. Then October 7th happened. Everything that we realized was important at the time became even more crucial. Now we not only have the residents of the regular issues that people have to cope with, we have wounded soldiers, wounded young people from the Nova survivors who live in northern Israel, require both physical rehabilitation but also mental support. So not only are we establishing and opening now the first and only rehabilitation center of the North, we're also building a mental health institute that will provide the very, very much needed mental support in northern Israel.
You touched on something very important that people don't really understand, is that having a facility where you live, right? And sometimes you take for granted how close you are to a hospital or a center. The fact that you're able to do this, and it gives comfort to those families that they have multiple kids, or they have you're able to maneuver in a difficult life cycle. What are you seeing sort of in the communities that you're servicing for this initiative? How are they reacting to this opportunity?
We're seeing a great demand, a huge demand. What we thought or what we knew would be very needed, we're seeing how much it is even more needed now. We already have people waiting on waiting lists, very, very waiting for a very, very needed support that they didn't have access to before. Now people sometimes would take the effort and go to the center, but rehabilitation and mental issues are very prolonged processes. It's not something you go for a week, take care of, and come back. It can take months and it can take years. So having accessibility to these services in close to their homes and close to the families is a savior.
And rehab is different than mental health, right? It's a two separate sort of ways of having to cope. So you can be injured physically, but then you could be, injured mentally. And we're seeing an increase in that. And we talked a little bit before how rehab was always, an important part, and it was so almost lacking in the country. And now we're seeing the mental health system that is, I would say it's in a disaster state or a non-existent state. So how do you deal with hitting both at the same time? and what's the process here?
So we're working with them. Let's go.
It is both services of both fields are an existential necessity at the moment. Very often they're intertwined. So most people who have to go through rehabilitation process are to some extent also in a need for mental support, and vice versa. We have treated children at a rehabilitation service, a rehabilitation center that didn't officially or didn't have the physical disability, but they couldn't walk because of the trauma of the war has basically impacted their physical status. So you treat them, and you realize you have to give answers to both areas. You have to address the physical need, and you have to address the mental need. We are building or currently planning the mental health institute. It will open in 4 years, but we cannot wait. We have to address it already now. So we inside our rehabilitation center, we are currently opening a temporary mental health hub that will provide solution both to the patients but also to the families and to the residents of the North. There is so much work to be done in this area right now.
Where can people learn more about your facility?
You can go in to find Tzafon Medical Center online, and you can read more about what we do there.